Welcome to Night Medicine with Miss P. I gave up on my clicker. It's crap, so I'm all done. And I know I got this weird collar thing going on with my. I just try not to get distracted. Just don't look. Um, I'm gonna run through a couple fun stuff of things I've seen charted, and then I'm gonna get out of here because I just came from her room again. I don't know why I do it. I need to just walk past it. I have one rule: don't eat upstairs. Just don't eat upstairs. I can't. I found a meal. Like if I put everything together it would be a complete meal. Anyway, okay, so couple things. I guess I left off at the end here. I'm not sure, but hopefully I won't repeat myself of things I've read in the past. Okay, this I can't tell only because of my writing. I rewrote it off of someone's paper, and I think it says what they charted was CBA with dyspnea. I think that's what it says. CBA, like C as in cat, B as in boy, A as in apple. I'm sure they meant CVA, but the problem is students hear stuff, they don't really know what it is, so they just kind of repeat it. Like I said, like children, they don't know what they're saying, but they've heard it before, so they repeat it. But there's no such thing. I mean, that may be a thing. I don't know. I'm learning stuff all the time. Respiration, strong and equal. All right, well that's good. I'm not sure what they're equal to, but all right. Bowel signs active. Ooh, the bowels are signing actively. Knowledge deficit related to ignorance. Now, while that one is hilarious and I enjoy it, I do, that's not really the way that works. So when we're doing a care plan for knowledge deficit, it has to be related to a specific issue. And it could be like related to diabetes, or their, diagnosis of diabetes, or related to recent diagnosis of CVA or recent event of CVA. And then as evidenced by, and their evidence has to say, I didn't know that. I had no idea. Nobody ever told me. So that evidence is proof that they didn't know. That's what knowledge deficit is. Ignorance, a completely different thing. Not a nursing care plan. A real thing, a real issue that I battle every day. Even with myself, the things I'm ignorant to. Like I think that my daughter's ever going to listen to the rules of the house. Either child is going to listen to the rules of the house. They're not. They're just going to do what they want, and I'm just going to have to deal with it, I guess. But I tell you what, when they have their own rooms, their own homes, I'm not kidding. When they move out and they have their own homes, unless I really, really love the people they're married to, I'm hoping maybe they're single for a little while and have their own home, because I'm going to go over to their home and I'm going to bring Cheetos and Cheez-Its and oh, those Nature Valley granola bars that if you take a bite that it just crumbles into 1,000 pieces. I'm going to sprinkle that. I'm going to sprinkle that stuff all throughout their house. And then I'm going to ask to use their bathroom, and I'm going to pee on the floor in front of the toilet. Not in the toilet. I'm just going to squat right there on the floor in front of their toilet. That's what I'm going to do. I'm going to do it. Okay, patient uses a wheelchair to ambulate. Okay, now this I have gotten repeatedly, and I love it every single time. Patient uses wheelchair to ambulate. You know who you are, don't give yourselves up. I understand what you're saying, that they kind of pedal themselves. You've seen that. They're in the wheelchair and they kind of pedal themselves with their feet. That's not ambulating. It's fabulous to chart that, but it's not ambulating. Ambulating literally means you're up and walking. Now, they transport themselves via wheelchair, by pedaling, but that's not ambulation. I've gotten that a couple times. I love it every time. Patient in ER got a Fleet's enema and Solumedrol. Okay, that could be true. Two things could be true at the same time. While that patient was in the ER, they could have received a Fleet's enema. And I'm assuming, let's hope, a completely different reason, they also got Solumedrol. But you could see that the way that's charted could be a little misleading. O2 sat 97% O2 at room air. I get that all the time. Glaucomia nebulizer for ischemic colitis. Glaucomia nebulizer for ischemic colitis. I'm not even sure how one came up with that. What could that chart have said, or what could she have gotten in a report, or that's what made it to the page? The glaucomia nebulizer. Do you think you inhale that or you think you put it up to your eye? I don't know. Intact versus in place. Oh, yes. Yes. Okay. Um, I did have a student chart skin, warm, dry, and in place, which is a good thing. You know, you want your skin to be in place. But intact is a completely different thing. Like your glasses could be in place. Dentures could maybe even go either way, but your skin needs to be intact. Ideally, maybe if you're assessing a graft, you could say that the graft is in place, I guess. Bilateral lower extremity knee replacements. In case you were wondering where the knees were, they are in fact in the bilateral lower extremities, generally. Sometimes they're not. Fluid retention saw in calves. Oh, you know when your calves retain the fluid, you just have a lot of built up right in the calves. Not so much in the feet or ankles, but it just kind of hangs there in the calf. Now, you know what? Depending on the patient's position, it's possible. Probably not the way I would chart it, but it's possible. Pulse 48, patient still shows no sign of bradycardia, except for the 48, which is indicative of bradycardia. That's the first sign that they have bradycardia is the number being below 60. 48. Impaired transfer mobility, not a thing, but okay, related to an unhealthy accumulation of body fat. They've accumulated enough body fat to have impaired transfer mobility. Now that's, I understand where you're going with that. Not how we word that, not how we chart that. That is not how we do that. All right, and I think we got through, I think that's the last page of, oh no, here's the good stuff. Okay, now some of this stuff, I hope the thing isn't on here that makes me laugh to where I can't. There's this one thing a patient said, I may be over it by now, but every time I tried to read it, like we're talking every single time I tried to read it to a student, I couldn't. I would go into that making no noise laugh because it just the way she said it, it just was hilarious. And I don't even know that she said it. I think it was something that they wrote down, which just puts a different image in your head altogether. Okay, so these are from nursing students. All right, this one said, oh, God, there's so much wrong with this. Patient had a busted eardrum from high blood pressure. All right, now I've seen a lot of blood pressure crises in my time. Some hypertensive crises that really could lead to hemorrhagic stroke and other things. I don't know that I've ever seen the blood pressure so high that it ruptures your tympanic membrane, aka busts your eardrum. I don't know that that's a thing. I'm hoping not, because I would only assume that would be very painful and bizarre. I don't know that, like, anatomy wise that can happen. Nurse notified of blood from trach. Okay. Now, when I see stuff like this is handed to me oftentimes around 1 o'clock, sometimes 2 o'clock. Those are things you should tell your instructor immediately. Like if you go and you see that there's blood coming out and around from the patient's trach, chances are maybe it's, I don't know, maybe it's new, maybe the skin got irritated from a lot of movement or coughing or vigorous suctioning, I don't know, but the risk of it coming from the lung is worth talking about. So I would think you should maybe have done something about that and probably told your instructor. Oh, this is one of my favorites. Mute speech. So no speech, they're mute. That's called aphasic. Contrary to what a patient once told me, that he has aphasia from, I can't even remember what it was. I talked about it on here. And they don't understand. A in front of a word means opposite of, right? Like anesthesia, opposite of sensation. You're not going to have any sensation. You'll be numb. Aphasic means no speech. There might be sounds or that sort of thing, but there's not speech. Dysphagia could be difficulty speaking, right? That's what it means. It's not could be, it's difficulty speaking. So they may have slurring or, garbled speech or that sort of thing, or as students say, gargled speech, right? Talked about that last week. But mute speech, It's that's not a thing. I do enjoy that though. Oh, this one student wanted to assess the amniotic fluid every 4 hours. I don't I don't know how one would do that. Are we doing a centesis? Are we doing an amniocentesis? Or are we is that via ultrasound? Just an ultrasound the baby to death every 4 hours? That's you can't do that either. Patient complained of pain, Lasix given. Okay, well, maybe there was some severe ankle, foot, calf pain, and they were so swollen, so edematous that yeah, I'm putting lipstick on a pig here, y'all. It's not a all right. Apical +3 regular irregular. I got nothing. I don't see. Do you see? So as I'm grading these, I'm like, what could that even? I know they're grading the apical pulse like we would a peripheral pulse, and it's regular irregular. No. Maybe they mean regularly irregular. Still, y'all learn your adverbs. No cough, sputum clear. If there's no cough, how did you visualize the sputum? And if the sputum was clear, what would they be coughing about? I don't know. Oh, this, and you all remember this. There was like quite a few people involved in this one because I would rotate the patients. I'd reuse the patients. I would recycle, let's just say, my patients. So I knew them so well that anything you charted, I don't even have to go in the room. I know what these patients look like, especially when the student after student has the same patient. So this patient had a IV, stay with me, at 30 milliliters an hour to the left upper quadrant. All right. Now, either the person that inserted this is really, really good with IVs, or this is the most vascular patient I've ever seen. You'd be like Chris Hemsworth. I bet we can find a thing along those abs, huh? Maybe, I don't know. But then another student came on and they cleared it up for me. And he said to my face, oh, no, it's a sub-Q IV. Michael, there's not it's a subcutaneous infusion or an intravascular infusion. You can't have both. Nope. Okay. 8 very pale. Maybe they were pale while eating. I'm not sure. Upper bases. That's one of my favorites. And I just wrote that down because it doesn't matter where you add that in. That's what students literally say. They literally say upper bases. I've gotten that many times. You know what a base is? See, back in the 80s, that's really all we listened to was bass. It's really hard and low, and that's where your bases are. There's apexes and bases. There's not a upper base. Alert for brief periods. They're wide awake and then not. And then they're very alert and then not. That may be a medication issue, I'm guessing. I don't know. Okay, so the little research paper I got that explained that dialysis uses special water to clean the blood and then put it back in. What do they use? They use special water. It's literally what they wrote. Special water. That's good stuff. Oh, and another care plan I got as a nursing diagnosis, fetal anxiety. You know when your fetus is very anxious? Fetal anxiety. I've done these so many times. I wonder if I've done this before early on. If I mentioned some of these or but God, these are good. Oh, that one I'm gonna have to write down. Fetal anxiety. I'm gonna draw a line right there, and we will pick up. I hear it's raining and my dogs are outside, so I gotta go. I had my windshield fixed on my truck earlier today, and it's been a busy morning. I got lots to do, so we will we will pick up there next time because I'm at my 15-minute mark, which, as we know, is the attention span of your average individual, I guess, or so I'm told. So, same as always, face your fears, forget your failures, follow your faith, and I'll try to also. All right, till next time.